Good afternoon. My name is Lydia Owens, and I am part of the Durham Residential Program. I did research in computational science this summer, and my paper is titled AABMCOP, Applying Agent-Based Modeling to COVID-19 Outbreaks in Prisons. So first, starting with the epidemic behind bars. COVID-19 has affected the entirety of the United States for the past 2 years, but nowhere has it hit harder than our prison systems. It was estimated that in 2021, 1 in 5 prisoners were infected with COVID-19. And you can see in this graph here, the differences per 1,000 people of incarcerated people who were infected and non-incarcerated people who were infected. We know that things such as non-pharmaceutical interventions like social distancing, masking, and other protocols were not implemented in prisons until very late in the disease transmission. We also know that variants such as Delta and Omicron are continuing to affect how COVID-19 is spread throughout the nation today and still affects how it is spread in prisons as well. And so what I did during SHRIP was use computational epidemiology to develop a model like the one that you see here below. You can see that on the left, there is a transmission model, which basically goes through each possible biological state a person can have once they are infected with COVID-19. And then what you see on the right here is something called a geographical contact network. And so within this network, you have people or agents placed on a grid that have certain behaviors that are governed by the model's parameters and can go through different transmission states of COVID-19 over time. And so altogether, this is called an agent-based model. And so for my project, I'm using agent-based modeling in R. And in addition to using agent-based modeling, I'm using 2 techniques called stochastic optimization and simulated annealing to figure out the best parameters to run my model to. And this can be explained by the figure below. You have the environmental noise, which is all of the policies, procedures, and other things that go into how a prison is run. And those are placed on top of the population, and the population in this case are incarcerated people and guards. And what you get out is the population fluctuation. But it's not the fluctuation of people in the prison, but rather the fluctuation of the number of transmission states that the prison goes through. And so as you can see here, these are some graphs that I have made using agent-based modeling in R to visualize my work. What we have on the left is a accepted, exposed, infected, and recovered model, which is a linear model that shows the different transmission states of the prisoners. And on the right, what we have here is a sample geographical contact network where we assume random mixing, and you can see how all of the different agents, there's 100 incarcerated people on this plane, go through the different transmission states. And at the bottom here, we have a graph of the empirical data that was gathered from the Mecklenburg County Jail. I hope to work with the North Carolina Department of Health and Human Services in the future to collect data for all North Carolinian prisons on COVID and run through my model to help perfect its parameters. And I would like to acknowledge everyone on the screen, especially Mr. Gottwals and my mentor, Dr. Zachary Ward, from the Center of Decision Science at the Harvard University School of Public Health. I would also like to acknowledge the Borough's Welcome Fund and the NCSSM Foundation for their generous funding of research in computational science. Thank you so much.